Hi, my name is Morgan, and I'm going to be talking about a disease called acute post-strep glomerulonephritis. So it's a disease that's characterized by the sudden appearance of edema, hematuria, which is blood in the urine, proteinuria, which is blood, or not blood, protein in the urine, and hypertension, which is high blood pressure. Acute post-strep streptococcal glomerulonephritis results from an infection in the skin known as impetigo, or it can also result from an infection in the throat, and it's caused by a nephrotigenic strain of a group of bacteria known as A beta hemolytic streptococci, which is also the same bacteria that causes all the different types of strep. So acute post-streptococcal glomerulonephritis occurs predominantly in young men, and it often completely heals without further issues. So the most common signs of this disease are hematuria, which, as I said before, is blood in the urine. It can be an alarming amount of blood that's very noticeable by the parents, or it can be a very small amount of blood that isn't even seen in the urine without a microscopic urinalysis. Some other symptoms of the disease are edema, which is just swelling, and hypertension, as mentioned before. The child will present with high blood pressure. So some children may present with none of these symptoms and just have normal or just a little bit of mildly elevated blood pressure. So the most universal finding is blood in the urine, and that occurs with 1 out of 3 patients that are diagnosed with this disease. So it can last up to 10 days after being diagnosed, especially if the child is experiencing a fever. It may last even longer. So the edema occurs in 65 to 90% of the patients with this disease, and it tends to last between 7 to 10 days. So some parents are concerned about pulmonary edema, which it's not very common unless it's a very severe case. The hypertension occurs in 60 to 80% of cases and usually only lasts about 10 days, so it's not a permanent alteration. To diagnose this, the doctor is going to have to order a urinalysis to detect for blood in the urine, hematuria. A kidney ultrasound may also be ordered to assess for damage to the kidneys because, as the name of the disease is acute post-streptococcal glomerulonephritis, and the glomerulonephrites are just the little tiny filtration, little tiny systems in the kidneys that filter everything out into the urine. So when those aren't working properly and they're swollen and damaged, that's what can occur the blood and make the child sick. So when they order the kidney ultrasound, they're going to assess for damage. So this disease is most common in children between 4 and 12 years old, and it's very rare to occur before the age of 2 or after the age of 18. A culture may also be performed on the throat or the skin, depending on if they had strep throat or impetigo that caused the acute post-streptococcal glomerulonephritis. So treatment of the disease, it will start when they start to notice the symptoms, and that's when the child has already begun healing and the kidneys are trying to heal themselves. So the initial management of the edema and the hypertension, if they're experiencing that, is going to include some degree of fluid and salt restriction, along with not antidiuretics if they require that. Thiazide diuretics are usually the diuretics of choice because they also can effectively control the hypertension. So another thing you can do is use loop diuretics, but they need to be used in high intravenous doses depending on if the child has an IV or not. The child may also require multiple treatments of antibiotics if they're still testing positive for a strep infection, as it may be quite serious and hard to treat. So some nursing interventions for a child that has been diagnosed with this disease are you need to assess the child for edema. The child's vitals need to be monitored, especially their blood pressure and their heart rate. you need to be able to calculate their intake and output throughout the day and also document it. Their food intake should be watched closely, and foods that are high in salt should be limited or not given at all. And if the doctor has prescribed any medications such as diuretics, antihypertensives, and antibiotics, the nurse needs to administer these on a schedule. So basically, that's about it. All right, thank you.